Syphilis is transmitted through direct contact with infectious lesion caused by the bacterium Treponema pallidum. The bacterium enters the body through mucous membrane and tiny breaks or cuts in the skin. One of the most common mode of transmission of syphilis is sexual transmission, which can be vaginal sex, oral sex, and anal sex. And also, there is vertical transmission, which leads to congenital syphilis, that is mother to baby. That is transmission from the mother to the baby. The less common ones are kissing and transmission through blood transfusion. Sexual contact is the most common way syphilis is transmitted. This is how this thing happens. The bacterium Treponema pallidum is present in chancres, that is brainless ulcers, mucous patches, and condylomata lata. During sex, these lesions I mentioned come into direct contact with the genital mucosa, anal mucosa, and oral mucosa. From then, transmission would occur. Type of sexual contact include vaginal sex, oral sex, and anal sex. In vaginal sex, it can occur from vagina to penis or from penis to vagina. That is why condom is strongly recommended here to offer protection, even though condom may not offer 100% protection because it can tear during sexual intercourse. It can burst, leading to exposure of your mucosa to the infectious lesions, leading to transmission further. Transmission can also occur through tiny breaks or cuts in the skin or the area in which condom did not cover, like the exposed parts that the condom didn't cover during sexual intercourse. Transmission can occur in that way. That is why most people contract HIV without knowing during sex, even though they use condom, and they contract HIV and other venereal disease during sex because of this exposed skin surface in which tiny breaks or cuts may be present. This is how transmission happens. That is why you should be careful during sex because of tiny breaks or cuts or lesions present, which may comes in contact with the mucosa, thereby leading to transmission. And again, for anal sex, this is very risky because of fragile anal mucosa, and there is higher chances of micro tear in anal sex. Anal sex usually occur from penis to anus. That is when a man is putting his penis into anus or woman's anus. And for oral sex, it can occur from mouth to genitals or from genitals to mouth. This is when a man is licking a woman's private part, vagina or vulva, in order to derive sexual pleasure. Or when a woman is sucking a man's penis in order to suck sperm, because women think that sperm can fresh their body, can give, can maintain their body. I don't know about that one, but I will get to know it. Transmission can also occur even without ejaculation. These sexual contacts I have mentioned are the most common ways in which syphilis can be transmitted from infected person to another person. And again, oral chancres may be painless and unnoticed. Also, there is mother to child transmission, which results to congenital syphilis. This is how it occurs. Infected pregnant woman transmits this bacterium through the placenta and at any stage of pregnancy. The consequences are premature birth, miscarriage, stillbirth, and congenital syphilis in the newborn. This is a serious mode of transmission of syphilis, but it can be preventable and be treated. This is handled with antenatal screening and early treatment. Transmission of syphilis through kissing may be rare but possible. It is possible if one person has active oral syphilic lesions and if there are cause or sores in the mouth. Normal kissing without lesion does not transmit syphilis. Other possible scenarios are contaminated needles and accidental needle stick injuries in hospital setting. Transmission is possible when there is unsafe blood transfusion, but this is rare today because modern blood screening has made this route very uncommon today. This is the reason why why syphilis is not spread by casual contact. Syphilis cannot be transmitted through hugging, handshake, sharing food or utensils, sharing toilet seats, sharing clothes, or sharing swimming pool. Normally, this bacterium Treponema pallidum is very fragile and it does not survive outside the human body. It cannot survive on a dry surface. This syphilis is most infectious in primary stage, secondary stage, and less infectious in latent syphilis, especially in late latent syphilis. The factors that increases the transmission risk of syphilis are presence of genital ulcer, co-infection with other sexually transmitted infection, poor awareness and delayed diagnosis, unprotected sex, that is sex without condom, and having multiple sexual partners. These are factors that contribute to higher rates of transmission of syphilis and other sexually transmitted infections. So the roles of condom in prevention of syphilis and other sexually transmitted infections. Condoms reduce the risk significantly, though they do not offer 100% protection, as the condom can burst during sexual intercourse and uncovered area may be exposed to lesions, thereby leading to transmission. That is why HIV transmission can occur during sex, even when condom is used. Syphilis can also do as HIV. They are sexually transmitted. Despite this thing, condom is still strongly recommended. So syphilis is mostly transmitted through sexual intercourse with infected person. That is unprotected sexual intercourse, like without condom and without being tested. And the most sexual intercourse that usually take place, most common factor is vaginal sex, which involves genital to genital, that is penis to vagina or vagina to penis. So condom is strongly recommended here to give 70% protection. Transmission can also occur through anal sex with an infected person. And this is very risky because anal mucosa is fragile, like I said before, and there is higher chances of micro tears in anal mucosa. Oral sex occurs from mouth to genitals or from genitals to mouth, and men usually engage in this oral sex, like giving a woman head. That is what we should not do. You should not use the mouth you use to eat to lick woman's vagina in order to satisfy the woman. This is very risky. You should avoid that. The bacteria that is beneficial to women may not beneficial to a man. When it enters into your throat, it may affect your throat or pharynx. So that is why you should avoid using your mouth in woman's vagina. So woman's vagina or woman's private parts are where doctors use glove while working on it. Why are you using your mouth during sex? Women's vagina or vulva, other parts are where doctors use gloves to examine. You should not use your mouth on it. If you find this video helpful and educative, share to others so that they can learn. Subscribe, like, and comment. Let me know your thoughts about this video. See you next time.